Welcome to the PTI Nebraska YouTube channel. The following is a pre-recorded training presentation designed to educate and support parents, caregivers, guardians, and youth with disabilities, as well as the professionals who serve them. We're excited to have you here while you come learn with PTI.
This presentation will cover home and community-based service waivers, including step-by-step instructions on how to fill out the paper application completely. You will be able to access all the links to the forms in the video. They will be found in the video description. This presentation was created in partnership with PTI Nebraska and Southeast Nebraska Transition. First, we're going to discuss what are the home and community-based service waivers. There are 5 different options. First, we should note that these are programs that allow Medicaid funds to be used for services in the home and in the community. Most commonly, we hear about the Developmental Disabilities Waiver, commonly known as DD Waiver. Under this umbrella, there are 3 separate waivers. First, Family Support Waiver. Second, Developmental Disabilities Adult Day Waiver. 3, Comprehensive Developmental Disabilities Waiver. On the other side of the umbrella, we have number 4, the Aged and Disabled Waiver, commonly known as the AD Waiver. Not quite as popular, we have number 5, the Traumatic Brain Injury Waiver, commonly known as the TBI Waiver. First, we're going to discuss the umbrella of the Developmental Disabilities Waiver, DD. We need to keep in mind that individuals must have an intellectual disability that meets the need for intermediate level of care. I commonly tell families this is a watchful eye. First, the Family Support Waiver, FSW. This offers services to help children 0 to 21 with developmental disabilities continue to live in their family home. Developmental Disabilities Adult Day Waiver, DDAD Waiver. This is for individuals 21 plus, and this is going to offer services and support to those with developmental disabilities to maximize their independence during the day. These are normally provided by agency day service programs only. Comprehensive Developmental Disabilities, CDD Waiver, is for people of all ages. This offers the most support and the most services to those with developmental disabilities to maximize their independence. This is often when people start to receive housing options. Now on to the Aged and Disabled Waiver, the AD Waiver, which is available to people of all ages. This offers services to individuals with a physical disability and/or a health care or medical need. Commonly, I tell families this would be an individual that would need to receive care in a nursing home. So they require nursing level facility care. On to the Traumatic Brain Injury Waiver, TBI. This is for individuals 18 plus that have suffered a traumatic brain injury and also meet nursing facility level of care. Although this is not a waiver service, this is the Katie Beckett program. This is going to provide access to Medicaid only to those children who still live at home with their parents and whose family is not financially eligible for Medicaid. So that means we make too much money. The child must meet the level of care for living in a hospital, nursing facility, or intermediate care facility for those with developmental or intellectual disabilities. We need to keep in mind that there are no services that are included for this program. This program is going to require a separate application for Medicaid and will be found in the appendix. Now on to what you may need to know. Important links and materials. You can kind of read through this on your own, but it's oftentimes helpful to collect certain information before you even start the application. This list will help you gather those items before moving on to the paper application. Section 0, selecting the waiver. On this section of the waiver application, you're asked to select the waiver that you're applying for, and most of us have no idea. Eligibility requirements for the two different waiver programs that we commonly help apply for, DD or AD waivers, can be applied for both on the same application. For young children or young adults that don't know what type of support you need, apply for them both. It's one simple application. Each waiver has different criteria for eligibility, and that needs to be determined by DHHS. So select the waiver programs you're applying for and fill out the subsequent questions in section 1, 2, and 3. This is probably the easiest part, as long as you keep in mind that this is not a family application, it is an individual application. We're filling this out for the individual that we're supporting that needs access to Medicaid and service and supports to remain in the community. Keep in mind, if you're filling out this application with good old-fashioned pen and paper, write legibly in blue or black ink. Please include legal names of the applicant. If the child or young adult may have used another name, this might be included as well. This sometimes for adoption. If the individual is 19 years of age or older and does not have a power of attorney or a legal guardian, the applicant must sign the application. If there is a legal guardian or legal power of attorney, that person may sign on the applicant's behalf. This may be the section that confuses most people. Section 2. This authorized representative you're going to fill out if you want to grant a person to speak on your behalf only about this application. This could be a parent, friend, or maybe even a neighbor. This is going to help somebody, or this is going to be somebody that's going to help you answer questions and gather information regarding this application. Section 3, fill out this section if you are the applicant's legal guardian or legal attorney in fact, commonly known as power of attorney. Section 4, fill out this section if you are the parent of a minor child. In the state of Nebraska, this would be a minor child under the age of 19 years old. Residency. First section is foster care. You simply have to mark yes or no. Don't be nervous or scared. They're just trying to collect as much information on the applicant as possible. Fill this out as completely as possible. No worries if you can't remember the caseworker's name. Citizenship and residency. Keep in mind this is for the applicant as well, not the parent's immigration status. Simply mark if you are a citizen of the United States, place of birth, state, and country. If you have questions about your immigration status, please feel free to reach out to PTI Nebraska for more information regarding this section. Supporting information, foster care, or residency. Most commonly, I tell people to leave this section blank for right now. This is where we can add subsequent information or supplemental forms, adoption decrees, yada yada in this section. Something we can't fill out on another line or section throughout the application. Voter registration. Keep in mind that anyone age 17 or older can register to vote. It's important to note that having a disability does not take away your right to vote. Voting is a fundamental civil right and cannot be taken away due to disability. If you already registered to vote, simply mark no. Records. In this section, we need to make sure we fill it out completely and as fully as possible. These records are essential in determining eligibility. There are multiple sections to fill out. Make sure you list specific people you know that will paint the complete picture of your child or young adult. Check here now if you agree for the state to obtain information for this application on your behalf. The application or the information retrieved will be used to support the disability. Educational reports. This section asks for educational reports. These include MDTs for the last 10 years, or I tell families about the last 3. And you need to include a copy of the current or last IEP. Determination specialists will use this information to determine diagnosis, intellectual and academic functioning, behavior functioning, and adaptive behavior. They're going to want to look for consistency in the level of care. It's important to remember that we need to determine that this person had an intellectual disability before the age of 22. Medical practitioner. This section asks for medical records. If you have more medical practitioners or doctors than the section provides, please list them on a separate piece of paper labeled Section 9, Medical Practitioner, and list out all specialists. So this could be a neurologist, a geneticist, anybody that's going to have diagnosing information about your child, and then anybody that knows their current level of functioning. You do not need to keep or list practitioners that aren't related to the disability. So I'm not going to include my dentist, or if my daughter or son just wears glasses and doesn't have a major vision impairment. The state is required to reach out to each individual medical practitioner to receive documentation in the determination process. So we don't want to create any hangups and any useless information. Psychologists and psychiatrists. This is where they include their reports, their diagnosis, treatment plans, and the supports needed. If you've seen more than one psychologist or psychiatrist, include those 2 on a separate piece of paper attached to the application, and again, label it correctly, Section 9, psychologist and psychiatrist. If you've seen more than one in the last 5 years, please list them each individually. Therapist or counselor. Again, if you've had more than one in the last 5 years, include the separate piece of paper, label it correctly, Section 9, therapist or counselor, and list each individual therapist or counselor that the individual has been supported by in the last 5 years. Section 10, guardianship papers. There's not really a whole lot to fill out here. This is just your reminder that if you included yourself as a guardian or as a power of attorney in those beginning documents, that you're going to want to send along a copy of the court-appointed guardianship papers with the application. Do not send the originals, make a copy and send it with. Final section. Authorization for disclosed of protected health information. We've all seen this before when we've gone to the doctor's office. This page must be signed granting permission for DHHS to collect the information from the providers listed. I normally mark the period covered as life or birth to current for the individual. Normally down where it says this authorization shall be terminated on, I usually give them about 1 year from today's date. Again, the client's signature, if they do not have a power of attorney or guardianship in place, needs to be their own. If they do have a power of attorney or guardianship, client signature is not required, and guardian, or POA can sign on their behalf. Specific information to be disclosed. This a lot of times causes questions amongst professionals and family members. I like to give people access to anything that needs to be collected to determine my individual to be eligible for supports and services. So I go ahead and check each individual one. If there's something you're not comfortable sharing, such as alcohol and drug abuse treatment, simply leave that one blank. Otherwise, I would encourage you to check each individual box. Final section. Review the document. There is a tiny box that needs to be checked after you read the acknowledgments and obligations. Don't miss it. It just says that you understand that failure to fulfill the below obligations may result in denial or termination of funding for home and community-based services. In simple terms, we need to make sure that if information on this application changes during the determination process or soon thereafter, we need to make sure that we update DHHS with our current address, phone number, and email address. They cannot provide us the correct information and supports without it. There are multiple ways to submit your application. You're going to submit your application along with the release of protected health information and your power of attorney or guardianship papers and any supporting documents that you want to collect ahead of time to the DD Applications Division of Developmental Disabilities if you're applying for a DD waiver program. If you're applying for the AD application or the TBI waiver, you are going to mail it and notate it to the AD applications. You'll notice the address is the same. A tip and trick, sometimes I make 2 copies of the application and send it to each department. They're supposed to share, but sometimes it doesn't get to each department. And each department has a separate application process and eligibility process. So we want to get them both started at the same time. If you're uncomfortable mailing them, you are able to fax or scan them in an email. Both are options as well. We get a lot of frequently asked questions here at PTI Nebraska. How do I know if DHHS receives my application? I always suggest calling. The number is listed here. And just confirm that they've received your application. In a subsequent presentation, there's going to be an online option and you'll get a confirmation code. So we're going to talk a little bit about the timeline for determination to make a decision. We need to make sure that we're answering phone calls, checking voice messages, checking emails, and the U.S. mail daily. It's essential to have timely contact and follow up during these processes. If they're waiting on you, is another day that we're waiting for services. And if you miss a date or communication, they may deny your child services and you'll have to start the process all over again. Determination specialists will request information from the contacts you provided if you did not include the supporting information yourself. I always suggest to reach out to these medical professionals, to the school district, that they're going to be getting this request, and if they could return it as soon as possible. I always suggest checking in with the school or your medical provider to see if they've received the contact. Maybe they missed something. Anything to help the process move along as timely as possible. The timeline for determination is normally 60 to 90 days. But again, this is going to require diligent communication on both ends. If you're denied the application, I always tell people expect that denial. A lot of times there's just little bits of information that are missing, either from the educational documentation or the medical documentation. We have 60 days to appeal the decision. And during that time, we can reach out to the schools and the medical professionals to kind of beef up that information and paint a better picture of the applicant. Remember, they don't actually get their eyes on the applicant. We're painting that good picture through documentation and words. If you need assistance with an appeal, you can always reach out to PTI Nebraska, or you can reach out to DHHS for help. They can give you specific tips as to why your application was denied, and sometimes simply it's a lack of correspondence. You forgot to mail in supporting documentation in a timely manner. DHHS does not have time to follow each and every person around, making sure each and every piece of documentation is received. What do the different waivers do for my child, and how do I know which one to select? In the links, we have included a resource sheet. This lists each waiver separately and includes the benefits under each waiver. I kind of think of it as a menu. Communication with partners is essential. We talked a little bit about that, making sure that they're getting the request of information. And sometimes our doctors or school professionals do not exactly know what they're asking for. We've included links to important documents and forms, letters, and explanations to help you communicate effectively with your providers. If you have additional needs, please reach out. Thank you for listening to this presentation, and look for more information from PTI Nebraska and Southeast Nebraska Transition in the future.
Thanks for learning with PTI Nebraska. If you found this training helpful, please hit the like button, leave a comment letting us know what you learned from this presentation, and subscribe for updates on future trainings. For more information and resources, please visit our website at pti-nebraska.org.